Welcome back to the Deep Dive. We've been exploring how climate change, health, and justice are all connected.
We have.
And now, for the final part of this deep dive, we're focusing on a bit of an unexpected player, the healthcare sector.
That's right. It might not be the first thing that pops into your head when you think about climate change,
It's not.
but healthcare actually has this dual role. It's contributing to the problem, but it also has a huge potential to be part of the solution.
Okay, so let's break that down a bit. First, how is healthcare actually contributing to climate change? I mean, hospitals don't exactly strike me as big polluters.
Well, it's surprising, but healthcare actually has a pretty big greenhouse gas footprint.
Really?
Yeah, globally, the healthcare sector is responsible for about 4.6% of all emissions.
4.6%. That's a lot more than I would have thought. How is that even possible?
Well, think about it. Hospitals and clinics are huge buildings that need to be running 24/7. They use a ton of energy, lighting, heating, cooling, all that medical equipment.
Right, of course.
And a lot of that energy still comes from fossil fuels.
So the institutions that are supposed to be healing us are actually contributing to the problem that's making us sick.
It is a bit ironic, isn't it?
It's pretty mind-boggling.
Yeah.
But it also shows that there's a huge opportunity for the healthcare sector to change things.
Exactly.
If they're contributing that much to the problem, imagine how much of an impact they could have if they became more sustainable.
Right. There's so much potential for healthcare to really reduce its footprint and be a leader in the fight for a healthier planet.
Okay, so let's talk solutions. How can healthcare systems actually become more sustainable? Where do they even start?
Well, one of the biggest things is transitioning to renewable energy.
Okay, so picture this. Hospitals and clinics, powered by solar panels, wind turbines, geothermal.
Exactly. Making that kind of shift would dramatically reduce their emissions and show other industries what's possible.
It makes you wonder why it's not already happening everywhere.
There are some hurdles, but we'll get to those in a bit. For now, let's just focus on all the positive things they can do.
I like that.
Another important area is energy efficiency.
You mean like making sure they turn off the lights when they leave a room?
That's a start, but it's bigger than that. Think about better insulation, upgrading to more efficient equipment and appliances, designing buildings that take advantage of natural light and airflow.
So it's about being more aware of how they're using energy and finding ways to reduce waste.
Exactly. And it's not just about the buildings themselves. Think about all the stuff that's used inside medical supplies, equipment, pharmaceuticals.
Oh, right. All those things have a footprint too, don't they?
They do. The production and disposal of medical supplies have a big environmental impact.
So how can they address that?
Well, one thing they can do is prioritize reusable and recyclable materials whenever possible.
So cutting down on single-use plastics, finding ways to sterilize and reuse equipment, designing products with the end of their life in mind.
Yep, that's the idea. They can also look at their supply chains and prioritize local sourcing whenever possible.
That makes sense.
That cuts down on transportation emissions, plus it supports the local autonomy. So, another win-win.
There are so many different angles to this problem. It must be overwhelming for healthcare systems to know where to start.
It can be. But that's where innovation and collaboration come in. There are organizations and initiatives dedicated to supporting healthcare institutions through this transition. They share best practices and develop new technologies to make healthcare more sustainable.
So there's help out there.
There is, and it's not just about practical stuff like that. It's about changing how people think and behave. We need healthcare workers to be more environmentally conscious, too.
So we need greener hospitals and greener doctors and nurses, too.
Exactly. We need to make sure they understand the link between climate change and health.
How can we do that?
Well, it starts with education and awareness raising. For example, reducing unnecessary tests and procedures. A lot of them actually have an environmental footprint in addition to the financial cost. And then encouraging sustainable transportation for patients and staff, things like cycling and public transit.
Right. So if healthcare professionals are leading by example, that sends a powerful message.
It does. And this shift in thinking really needs to start at the top. Hospital administrators, policymakers, medical schools. They all play a role in making sustainability a priority.
So it's not just about individual actions, it's about changing the system itself.
Yes, we need leaders who are willing to invest in the changes that need to happen.
What about medical schools? Are they preparing future doctors and nurses to deal with climate change?
That's really important. We need to make sure that climate change and sustainability are part of the curriculum so these future healthcare professionals really get those connections between the planet's health and human health.
So we need to stop treating them as separate issues.
They're not separate, and it's not just about the initial training either. We need continuing education so healthcare workers can stay up to date.
So sustainability should be a core part of working in healthcare.
It should be. It's about transforming the entire culture of healthcare, making sure everyone understands that taking care of the environment is part of taking care of people.
It's pretty amazing to think about what we could achieve if we did that. It feels like the healthcare sector could really be a force for good.
It could. It absolutely could. But we have to be realistic. There are going to be some bumps in the road.
Okay, let's talk about those bumps. What are some of the biggest challenges healthcare systems are going to face?
Well, one is just the cost, making all these changes like investing in renewable energy, upgrading for energy efficiency, buying those more sustainable supplies. That costs money.
So it's the old, it costs too much to do the right thing problem.
Kind of. But we have to remember that these investments often end up saving money in the long run, with those lower energy bills, less waste, and even a healthier workforce. It's about thinking long term and seeing sustainability as an investment, not just a cost.
That's a shift in perspective.
And that actually brings us to another challenge, resistance to change.
I can imagine. Hospitals and clinics, those are pretty complex organizations.
They are, and they can be very bureaucratic, which makes it really hard to make big changes even when everyone agrees they're needed.
So how do we overcome that?
It takes strong leadership, clear communication, and a willingness to embrace new ideas.
So we need everyone on board and ready to change. What about the role of government? Can they do anything to help make these changes happen?
Governments have a huge role to play here. They need to create an environment that actually supports sustainability in healthcare.
Okay, so how can they do that?
Well, they can offer incentives for hospitals and clinics to make those investments in renewable energy and energy efficiency. They can set regulations that promote those sustainable practices, and they can fund research into new technologies that make sustainable healthcare more affordable and accessible.
So it's about creating the right conditions so doing the right thing is easier and more rewarding.
Exactly. And it's not just about governments, though. Regular people like us can make a difference, too.
What can we do?
Well, we can start by demanding that our healthcare providers take this seriously. We can ask questions about their environmental practices and make sure they know that we care about this. And when we have a choice, we can support the hospitals and clinics that are actually walking the walk.
So we vote with our feet and with our wallets.
Yes. Showing that we value sustainability and rewarding those who are doing the right thing. We have a lot more power than we think to change things. Every choice we make, every question we ask, every action we take, it all sends a message.
And all those messages add up to something bigger.
They do. Together, we can create a much stronger demand for change.
This conversation has been really eye-opening. It's made me realize how closely climate change is tied to everything in healthcare. It's not just about those big dramatic events like melting glaciers. It's about the air we breathe, the food we eat, the hospitals we go to, all the systems that keep us healthy.
It is. We need to realize that climate change is a health crisis, and we need to address it in every aspect of our lives.
And that means understanding that climate change isn't just an environmental issue. It's about social justice, economics, human rights.
It's all connected.
It's about building a world where everyone can thrive, not just do a privileged few.
That's what we're aiming for.
So as we wrap up this deep dive, what's the final message you want our listeners to take away? What can they do to keep learning and keep taking action?
I want everyone to remember that we are not powerless. We all have a role to play. It doesn't matter if you're a doctor, a nurse, a patient, a policymaker, a business leader, or just a regular person who cares. Your actions matter. Your voice matters. Your choices matter.
That's inspiring.
We have the power to create a healthier, fairer, more sustainable world. Don't underestimate yourself. You can be a part of that change.
Thank you for joining us for this deep dive into climate change, health, and justice. We hope you learned something new, and we hope it inspires you to get involved. Keep diving deeper, keep asking questions, and never stop fighting for a better future.
That's what it's all about.